Hello, my name is Anthony, and then the topic I had researched would be the collegiate athlete's mental health. So the structure of this project, I went from problem, solution, and benefits of it. So starting off with mental health. So the definition from it could be from would state being an individual's psychological and well-being. Uh, Also, we could see that student athletes could be the ones who could contain the most mental illnesses due to many causes of them, which I would cover in a bit. So, with mental illnesses, it could cause many different changes of the individual's psychological and well-being, such as affecting their emotions, behavioral, and thinking as well. So, with that being said, some of the causes of this would be from classes. So, from classes, it could be maintaining the well balance of going from practice and then automatically going to classes and understanding the lectures of everything like that, while being mentally and physically tired from practice or from a competition from it. So from the demands of sports as well could be another leading cause of mental illnesses for student athletes because student athletes do tend to have a lot on the shoulders, feeling that they are dependent of the sport and the team, if they are, or an individual as themselves. Also, another could be outside of school and sports, such as family issues, financial issues, or uh, outside problems that most of us could have. So with that being said, there are some results due to these causes. So the most common mental illnesses for student athletes could be from depression and anxiety. Some may suffer from both, or some may just have one of each. Um, with that being said, from coach who studied if depression and anxiety do cause injuries for the student athletes itself. With that being said, they have found that it does. So basically, they gave a brief description of the how the athlete focuses on other than protecting their body and focusing more uh, of the outside things that they're thinking of, such anxiety of probably something they have something else on their mind. Also, another could be another heavy toll. Results could be from student athlete could possibly take their own lives and probably and move on to drug use as well. So, from a recent report in the NCAA in 2015, Lauren Morris and their studies have found that the fourth leading cause of death for a student athlete would be from suicide due to depressive symptoms and or deeply low moods of the athlete of themselves, which again, no one would want to see that at all, but it does have a heavy toll for those who suffer from it. So who is most affected from this will be from Laura Morris have found that female student athletes tend to develop more depressive symptoms uh, and compared to males who uh, have less compared to women. Um, Also comparing from individual sports and team sports is found that individuals tend to have the most uh, have have tend to most pressure on them, causing them to have more anxiety of their individuals of themselves rather than team sports, due to as a team you have someone next to you and you could count on, and so basically and being supported around. So moving on to solutions. So from that being said, that for for solution from seeking help, so no one should be ashamed of having a mental illness. Many do have some. Trusting someone to talk to, just having someone next to you or someone who you trust to vent out to could lift a heavy toll off their shoulders. Some programs and interventions. So Chow's uh, 4-week program does relate to Hiller's as well with their intervention and program idea. So basically, they're both ideas from it would be from attacking the stigma of mental illnesses and reducing it to not being something that's bad and represents someone who someone who can get help and someone that is seen as different but is not. But yeah, so it basically helps them understand if they do have a mental illness that they're not aware of, and they could attack it from there and help reduce it from preventing to getting worse from it. So moving on to support and awareness. So coaches, professors, and counselors should be uh, part of a program that could detect helping students or student athletes as well, especially student athletes due to time management, focusing school and their team and of their sport, and to understand that to be in their shoes to understand what they're going through and understand and helping them out moving to the right direction of getting help if needed. But yeah, so I mean, uh, pertaining to student athletes, it does tend them to have a rougher time to vent out, but by little, uh, it could possibly come out, and then we would want to help get better for themselves. So that's for so those are for them solutions. So from benefits of this, from the solutions would be from improving mental health due to those who want to seek help, improving it. Also, those who do seek out help and understand that it does help, they could encourage others as well to to seek help as well to help them out to improve their health mentally, giving them a healthier lifestyle, such as being more social to your family and friends or being more outgoing towards it. But the whole point of this uh, research would be to that we need to reduce the stigma of mental illnesses not representing it. It should be a bad thing that could represent someone's life, and understanding um, that it is something that could be improved, and little by little, it may be time to time, but it is something that we do care about, and we should focus on more than talk about it more rather than just uh, kind of pushing it to a side. Um, well, yeah, I mean, please, if anyone who's dealing with a mental illness, please seek out help or talk to someone. Just try to um, push yourself little by little to improve yourself. But yeah, that would be concluding my research project. Thank you for listening, and I hope all of you have a great day.